Hello and welcome to the Posture Dojo podcast. My name is Sam Miller and I'm your host on this postural transformation journey. Some stories from my own healing journey of an 85-degree kyphosis, as well as speaking with experts from a variety of fields, some that may be more surprising, some you might expect. Today I'm excited to have Hagit Berdishevsky out of New York, who is a extremely well-trained and certified Schroth therapist, as well as a lot of other disciplines. So Hagit, I'll let you kind of explain, how did you end up in this, and how do you currently describe what you do?
So I was working after physical therapy school, at the Hospital for Special Surgery in New York, Manhattan, with one of the greatest, there are many great, one of the greatest spine and scoliosis surgeon, Dr. Boachie. And working with him and watching and observing his complex surgeries to correct the spine in New York and in Ghana, Africa. I went on a few missions to Ghana, Africa, and met those complex spine conditions like 100 degree, 120 degree of scoliosis. For children, have to go under surgery. I decided, and I was actually also encouraged by this Dr. Boachie, to try to see what can we do a little bit earlier before it becomes severe and complex spinal condition. So I took this, I guess that was the mission of my life, I didn't know until then, to explore the world of conservative method for scoliosis, starting with the most researched, evidence-based Schroth method. This is what caught my interest. So I went to Germany and I studied the Schroth method at the original clinic in Bad Schubenheim when Krista Schroth was still alive, and I worked a little bit with her. And I took the course from Axel Hens, who used to work also at the Katarina Schroth Clinic. And after a year or two, getting involved into making Schroth available in New York City and conferences and inviting people, I went for another conference. Actually, my first sort is the Conservative Society for Rehabilitation. So I went to SOSOT. It was hosted in Barcelona, and then I met Dr. Rigo. Dr. Rigo have a branch of Schroth School, or Barcelona Physical Therapist Scoliosis was back in the day in 2011. And I met him and his group of teachers, that basically 5 of them are from Israel. And there was a great interaction, and I decided, okay, I would like to also explore the Barcelona Scoliosis Physical Therapy School, which is teaching the Schroth method as well. So I took his course, another 10 days to learn the method, how to treat patients. Came to New York City, enhanced my skills, and from then I just really, I think, my passion, I find my passion, I find my heart, I find what I love to do, the population, the interest. And I can tell you, I took maybe 7 or 8 times the same Schroth course as a physical therapist. Every time learning more and more, like reading the same book or watching the same movie and getting more details. And this is the way I believe therapists need to continue and study the same thing and just getting more skillful and polish their skills. And at some point, I wanted to become a teacher for the method, like Dr. Rigo himself. I wanted also to teach the method in New York City. And when you have an interest in teaching, you basically, again, becoming a student on a different level. So I passed what needed to be passed to become a teacher. And since 2013, For 11 years, I'm teaching the method in New York City and all over the world, honestly. Whoever wants to invite, I'm coming and teaching. I think we need to spread the word. We need to help patients and the community. And yeah, and there's a lot. This world, when you have a niche, it's endless options to study different methods and learn however you can learn about the topic.
Yeah, what an incredible history and journey you've been on. I think you've met with some of the who's who of the Schroth method and some of the more conservative treatment methods. You've really collected an incredible experience here. And this is something you started out as a surgical assistant. So I mean, you've got a very unique perspective on this whole idea. So, have you been through this yourself? Because when I speak to people who have scoliosis and kyphosis, they approach it in a different way. So how did you become so fascinated with this in a way that has allowed you to get such a broad range of experience?
I don't have scoliosis, that's correct. And really, I don't think anyone in my family. So this came from, I always loved biomechanics and physics and anatomy. So I love the material of the body. Then, I don't know if you want to call it luck, really a luck. I feel lucky to be involved. I was involved in what can I tell you? #1 hospital. It's the truth. It's written on the entrance to the hospital. Was chosen in the United States as #1 hospital for orthopedic surgeries. So a combination of interest in the spine, interest in mechanics, great people to observe and learn from all along the way, and just this combination. And when it's translated to the families and patients, I realize this is the win-win. I enjoy what I love. I enjoy what I do. I love the people. I love to treat. I love to touch. I love maybe it's the artistic part in me. My families are all artists. I've understood why I'm not really a drawer or a painter or a sculptor. But I think here I can express my hands and not just me. I'm a channel off, and many people are as well. You need to also have some sense of visualization and tactile cue and love to work with people, and all of it's like that.
That's amazing. You're on a really beautiful path here. And you mentioned now that you've started teaching, you're learning in a whole new way, right? When one teaches to learn, through the teaching process, we learn how to communicate that and understand it at an even deeper level. And that's, I think, one of the most important things that I see that you're involved in as well, is that a lot of people they'll go through the conventional system, which will be the general medical doctor, and then they'll get referred to an orthopedic surgeon, and he'll decide whether bracing is an option or surgery is an option. Now, if those things aren't in the best case scenario, then if he knows of a physio, he'll refer that. And then if he knows a Schroth specialized physio, then that's obviously that's really the best option that people have a lot of the time in the current system. And this has evolved, right? Because when I went through that system when I was 16, 18, and early 2000s, that wasn't an option. It was really surgery or not, bracing or not. If not, good luck. Maybe some regular physio. So the more physiotherapists that are adept and trained in this method, the better. Because I feel like so many people are being left behind just because of their location or just not having a Schroth specialized physio in their area. So maybe I'm curious, what do you see in this kind of macro perspective of what's happening and how the conventional system approaches these types of spinal compromises?
Okay, that's a very good point what you said, and you're right. We wish that in every place around the world, let's say, all the options will be open for the different people, the different diagnoses, the different people. The diagnosis is not the person. So for different people, yes. Some areas, some places, it exists. And when this teamwork exists, like I can tell you in Columbia University Medical Center, where I worked when I after HSS, I opened the Spinal Scoliosis Care Center at the Columbia University Medical Center with an amazing surgeon, also very well known, Dr. Michael Vitali, pediatric surgeon. He was the chief and president of the Pediatric Symposium of the United States. And he's a surgeon, an excellent surgeon, but he knows the indications and the parameters, and he doesn't push for surgeries when it's not necessary, or even if it's necessary. We had cases together of 50 degrees, 45 degrees, where in many places these kids will go under the knife because there was lack of information that you can try and see is another a stage of the game. Maybe this person is a high-level athlete and they don't want to have the surgery until they finish college, get their scholarship to college, and will operate later. Maybe they are willing to try because they have an athlete mind to exercise and do the bracing and try to do anything before the surgery. Maybe that person is someone who just cannot tolerate a surgery or a brace, sensitive to the skin, compromised in their sensitivity, but also mental capability. There are so many cases that bracing and surgery are not for a certain person. Not to talk about the fact that some people prefer to live with the spine, even in 50 and 60 degrees, saying, I will try to hold the progression. Maybe give them a chance. It's very complex, and this is a whole discussion that I do also with my patients and family, and with the surgeon themselves, and with the orthotist, when to have a surgery. It's a discussion, we can talk about it later. But anyway, in Colombia, we have few surgeons that assisted me to open a conservative clinic, not afraid to lose patients and not operate on them, but give them the chance for conservative method, give them a chance for bracing. He sent our orthotist all the way to Germany to study the Rigo Shanu type brace, which it really works well with congestion, with Schroth therapy, because it's the same principles. So he trained an orthotist. He is very supportive. They have a psychologist there. They're having physical therapy. Centers like that, not hard to... every hospital, every clinic can send a therapist and an orthotist to study this material, and not being on the 19th, 20s far end of general therapy and not a 3D bracing. We really hope for a change in how to manage.
Yeah, so you also mentioned a psychologist in there, and that's part of what I'm certainly kind of implementing in my own approach is a more psychosomatic approach. So not just the physical bracing and surgery, looking at the spine like a physical structure, but also understanding how that psychological part of it, whether it's a chronic tension or a trauma that is housed very deep in the nervous system that might be contracting and shortening the spinal cord, and actually even part of this warping that happens. There's a lot of, I think, exploration that is happening in that area that's exciting. So it sounds like you guys have one of the greatest holistic teams in the world, because sometimes bracing and surgery is the option. You've got the cutting edge kind of bracing on your team. You've got the orthopedic surgeon, psychologist, as well as Schroth trained physiotherapist. So this is one of the complete solutions that I've heard. For someone considering that, what should they expect in terms of costs to be able to go through something like this?
What do you mean, the cost? Basically, first of all, in the United States, there are insurances. So I don't know if you're talking about something private, But in United States, in a hospital-based, if they work with the insurance, most places work with the insurance, the therapy works with the insurance. So patient pay almost nothing. Then the bracing works with the insurance. You get the best brace in the world, and if the referring doctor write the Rigo type brace, a lot of it is covered. Now depends one visit with a surgeon because you need an orthopedic specialist. If they don't take insurance, maybe you're talking about $400 for one visit. Usually you don't need many visits with the surgeon. They just need to diagnose you and tell you surgery, you continue, bracing, insurance cover most of it, therapy, insurance cover most of it. Just a visit with the surgeon if this is it. And most of them also take insurances, all the insurances. So this is in the hospital-based good, and there are many great hospitals now. Almost every hospital have a Schroth therapist in the States. Now there is also private, right? There are private clinics, but then with the private, you stay in connection with the surgeons that you like, and then private clinic the prices are varies like the different flowers in the field.
Sure.
And if I can touch, I want to touch base on that.
Yeah.
You know what? I want to tell you something because I think it's something good if your audience will hear it. And you'll get what I'm saying. Katerina Schroth, in the entrance to her clinic, there was a sentence says, and I will never forget it, and it's go with me, and I tell it to all my students, empower yourself. This method is to empower yourself. So you learn the exercise, you know how to expand concavities, you know how to hold your posture, you know how to set the exercises because it's self-management for your body. Like I am going to the gym. Basically, it's good that I will know what to do. Some people have to go to classes and will forever go to classes for different reasons. One of them is socially, one of them is they want to somebody watching them and telling them what to do or following a good treatment. Yes, you can do that. They can come to me for 10 years, 3 times a week, pay money. But my goal, and this is how I tell my therapist that I release, I feel that my goal is to teach the patient enough session. We found at Columbia 10 sessions are enough to be compliant with the method. And now you review at home and you review, and I record the session, for example, every exercise, and that's how I teach all my other therapists that I send. Record for the patient the exercise. They will have it at home. They don't need to spend so much money because yes, there are clinics who charge $10,000 for 5 days, or I don't want to say ripping patients from their money. Okay, you have it, you want all the time the touch. I feel if I teach 10 sessions patients and I release them home and I can meet them on Zoom once a month, then whenever they want, I want them to be able to manage their life with scoliosis and not be, I need to do, it's not a torn meniscus or labrum, it's not a knee replacement that you need my hands all the time. Learn it and
empower yourself. That is beautiful. That is certainly the mission that I'm on, to help people understand their innate ability to address this and create the kind of opposite forces, right? If there is a compromise, there are so much that you can do, and these are things that you do need to take with you for the rest of your life. So it sounds like in your kind of preferred treatment plan, you have an initial in-person physical, and then from there it can be remote.
Correct. And self-walking, you can modify, you can do all the exercises, and you write what you said about reversing forces and fighting gravity. That's it. And it's not, and I tell my patient, you have your specific exercise. And what do you, I'm with aging, everyone, gravity wants to take us down. So I'm constantly trying to be aware of my posture, and I do exercise to keep my posture, just like you. Don't think that you work harder than it's okay. Don't feel bad about it. This is your specific corrections.
Beautiful. Okay, and Schroth allows us, scoliosis is this derotation, kyphosis, we have this collapse as well. Schroth, let's talk about the Schroth method and what this skill does for us. And then I'd like to get into kind of the different branches that I'm seeing of Schroth and people applying it, because I'm seeing a lot of variations of Schroth comes. Maybe, give us like maybe that overview kind of explanation of what is Schroth and what's happening with this method around the world.
Sure. The Schroth method is a technique to treat spinal conditions like hyperkyphosis or sway back and scoliosis in particular, those three. And it's based on series of three-dimensional exercises, positioning, typically symmetric, but depends on, at the end we're trying to get even in the three-dimension expansion of concavities, moving the trunk or opening kyphosis. Whatever we do, at the end, we are trying to create like that I'm showing you, a rectangle trunk. So you're expanding concavities if in the front or on the side. You are having three planes of motion, basically axial elongation, sagittal front and back for the derotation, and side to side expansion. But we don't really, once the patient is organizing their body, now they are concentrating inside, using their brain, their mind to use muscles to expand different concavities. So with muscle activation isometrically and with length, which is called eccentric, you are expanding. Then it's also involving the breath that come into the concavities that have been opened. It's like a vacuum. All of a sudden the air has space and it can go and support that collapsed here or here area. And then you stick it. You stay in a position, you opening what was collapsed, you keeping it, if I may go, let's say to here. And if I have a scoliosis and also rotation, I learn to use the muscle, arrange my body, and then continue while you don't see what I'm doing. But I am moving my prominence forward by expanding the ribs in the front, using certain muscles, expanding the convex, the curve from here towards the center by expanding. So it's involving muscle activation and breath and static positions, and with the goal to reshape the torso and to align the body. Now, there are different exercises. Lying on the back, lying on the stomach, on hands and knees, hanging, standing, sitting, different exercise. Most of them are static, so the patient can concentrate and do the correction. The Schroth method, the beginning was Germany. From the German, Katharina Schroth was a friend of Rigo's wife, mother, Elena. So they were friends. She's in Germany, she's in Barcelona. They were teaching in conferences together. They were discussing. Rigo opened his school, which was really the second school for Schroth. Okay, expand, good relationship. Then Katharina her grandson, Dr. Hans Weiss, he departed a little bit from, he's a surgeon, he departed from the Katerina Schroth clinic, he was involved, and he opened his own best practice. Best practice is another branch and teaches the Schroth in a modified way, in some modification way. From Rigo came ourselves, SSOL Schroth, myself and Andrea and our teachers. We branches from Rigo, we decided to open our own school in 2016. And also from Rigo came out Nikos, who teaches in Greece, PSSE Schroth. So there is not a lot. We are about 1, 2, 3, 4 Schroth, five with Doctor with the grandson. And I believe that I came from the German first and the Barcelona second. I know the German school because I know the teachers. They teach pretty similar to us. And I teach pretty similar, very similar, I think, to Rigo. I was influenced by Rigo. I loved his way of teaching. I loved his brain and biomechanics, and he goes very deep. And my demean is more like him. Plus, different courses that I took. I took the Italian method to treat scoliosis, SEA, Scientific Exercise Approach to Scoliosis, which deal with the activity of daily and different exercise. It's not like the Schroth. It involves more movement. So I have that, and I have the German, and I have the Barcelona, and I take some stuff here and there. But I think overall we are teaching the same. When there is a study from the German about Schroth, I feel that it really represents what I do as well. Like in life, sometimes you take off from your master that is about to retire, and you decided, okay, now it's my time.
How beautiful that this idea to empower yourself, to start pressurizing your breath and your physical position to actually become your internal surgeon, your internal physiotherapist in a way. And yeah, the way that we describe, the way we visualize that is different for each person. Understand about biomechanics and anatomy and how they just visualize this and imagine this in their mind. Everyone has a slightly different story. So
right,
and different spine. So I think different methods, different variations resonate with different people, but they're all tapped into this really powerful message that you can start to become the sculptor of your own body. That's really beautiful.
Yes, I agree. Yes.
So are there different techniques that you're seeing outside of Schroth that you're interested in integrating into this more holistic approach? Because for me, like the Schroth is a critical kind of understanding for anyone. And I think it is a slightly different topic, but there are some studies that have shown that people progress in their curves after surgery. And I feel like that is because there's a lack of this Schroth style teaching and education and empowerment, essentially. The same people who go into the surgery are not being given the tools to, which I think the Schroth could step in. Let's go there before I kind of talk about other related disciplines. There are studies that show people who go through a surgery continue to progress their curve. And I believe, or I'm guessing, that is probably something to do with a lack of that holistic approach, that holistic empowerment of people to understand that, listen, it's not just me doing the surgery on you, you're part of this process. Your breath is part of this process. Here's how to do this, and here's how to do it at home. And I feel partly it's because that conventional medical system is looking at things that they can guarantee results. And doing work doing physiotherapy, doing breath work, it requires a lot of compliance from the patient. And that's things that they like to avoid, right? They want to be able to do the surgery and fix the curve no matter what the compliance is. So do you believe, like, having, from your perspective, I'm curious, am I on the right path? Do you think that's why that is?
Okay. You said many things together, which these are all true.
Why are people, so I'll ask the question that will probably kind of bring it out. Like, why are people progressing? Why are the curves of people progressing after surgery?
Okay. Once I just wanted to read the message I sent you. And regarding this topic, okay. In the past, first of all, when there was the method to surgery was the Harrington rod. If you're talking about, I'm just saying for people in the audience who are more mature than us and maybe progressed in the Harrington rod, is because it was not really capturing every vertebra. It was capturing above and below, just the upper end and lower end vertebra, and the curve inside was not. And if they did it too early at the age, it could progress. This is one thing. Now let's coming to, okay, the method is great. Now we have good rods and screws and we can fix a person straight. The question is, there are many aspects to this answer. We can talk all about surgeries if you want in another, because I really have experience with that, it's true. If they did a selective thoracic and the lumbar region disappear, not under surgery, only the thoracic, which on one hand is something that they do want to do. Less vertebra operating, the better. Research shows that if you go down to the lumbar L5, the pain in the future, this patient tends to have more pain and disability in the future. That it is actually better to disperse the lumbar vertebra for mobility. But on the other hand, everything have few hands. On the other hand, when you don't operate to the lumbar, and if you're not compliant, as you say, then exercise and know to hold your body, and you think the surgery fixed me only, then the lumbar, like every other adult, the lumbar tends to degenerate and collapse. And we all have, where are the disc disease? Where are the spine degeneration occurs in most people without scoliosis? In the lumbar spine. So now you have also a more heavy, this area doesn't move, so the area below or above the neck or the lumbar now take most of the mobility, because this is now doesn't move, so the weight come in these areas. And if you are not exercise person, and if you not keep stability, then they tend to degenerate faster and become, we call it unstable. I don't like this word because it creates fear. They are stable, but they are unstable in terms of, yes, then progression can occur. Now also a little bit in terms of the surgical intervention, it depends, and this is again, it's a long process, but depends. What was, most of the curve that comes after fusion will become in the areas that were not fused. Now, should the surgeon fuse a little bit lower? How was the curve below before the surgery? Because sometimes there are two curves and they decided only to operate here in assumption that this, not just assumption, it's true, the lumbar get a little bit straighter. Sometimes it doesn't, and it progresses, and we don't know exactly why. Maybe the rods could have gone another vertebra. That's most of the cases. It's called an adding on phenomena. Adding on phenomena when the fusion was not going to the last touched vertebra by the center of the spine. There are measurements for the surgeons. Now, sometimes they actually speak ahead of time and tell the patient, hey, I only want to operate the thoracic because it's better by research to leave the lumbar. I wish they will tell them, but you have to be strong and exercise and go to get core stability. But not every surgeon does it. But they also tell them, I'm not going to operate on the lumbar because it's better not to. It's not so big. It's okay. And the patient needs to know, yes, I'm not going to get correction of the lumbar. I'm only going to correct correction of the thoracic. And the lumbar going to stay a little bit like that. It's an agreement. So depends what you encounter and see. Some stays here. Usually the area that was fused nowadays is not going to progress. It's below and above from all these points that I said. And the same thing, if they will operate on the lumbar and the thoracic is still curved and not being taken care, it will be the same.
Okay, so I know we're running out of time here on this conversation, but I certainly want to have you back to, I feel like we're just scratching the surface. There's so much we got into, and I think one of the most powerful message is that message that I think a mission that you've truly taken on, your own mission, which is to empower yourself, right? Whether you're going to get the surgery or not, you cannot go wrong by learning how to empower yourself through the breath.
Right. And it's even helpful for the surgeon. It is helpful if you come to the surgery knowing how to align your body. Then you're not going to get shocked when they really move you 30 degrees. There is no shock in the system. So no problem. I'll be happy to come back again.
So Hagit, yes, Hagit, please let us know, where can people find you? What are you only doing in person? Do you work with people online? And where can they find you? We'll have the links in the description as well.
Thank you. I work in New York City, in Manhattan, and in Israel. Right now I'm in Israel, sunny Israel. And I work via Zoom a lot, and it's very successful. People can try even one visit and see for themselves, but you can teach it via Zoom very well. And for physical therapists, they are welcome to go to Scoliosis and Spine online learning, SSON, and take on many webinars and education and come to become a Schroth physical therapist. I love teaching, and I think the world needs you.
Beautiful. Thank you very much.
Thank you so much. Thank you too.
The wisdom and the experience that you're piecing together here. This is really a special journey that you're on, and you're empowering so many people. So I appreciate you for that.
Thank you. Thank you for taking care for people as well.
Okay. Lovely. Thanks for tuning in, everyone. We'll see you in the next one.